Okay, it is, what is it, June 20 or something?
Yes.
Oh,
our
it's almost the
grandson's
first day of
birthday.
summer solstice. And I am Dr. Scott Geller, laser floater ophthalmologist in Fort Myers, Florida. We have a great patient from Peru, Indiana. Let me give a little recount of your story. Were the floaters present before the cataract operation? No. So you had a cataract operation, multifocal implant, and subsequent you developed a vitreous separation with some large floaters, correct?
Yes.
And that's not an unusual story. I see a lot of patients like that. We call that a posterior vitreous detachment. Uh, what was the first thing they told you was the problem when you said, I've got this stuff blurring my vision? What did they do?
It's been a while, so it's hard to remember all the stuff we
Did
went
they
through.
do the capsulotomy because of that when you said your vision was blurred, or was the capsule blurred?
Um,
Well, don't you recall exactly?
I'm not exactly sure
Okay.
right offhand.
I've seen unnecessary capsulotomies because of misdiagnosed floaters. And how long after that did they realize that the floaters were causing an issue for you?
It was quite a while after that because I kept complaining that I couldn't see real well. And I think they finally realized after me complaining quite a bit that
Did they understand what you were talking about?
They said that they could tell that it was a large mass.
mass.
At some point,
Yes.
but initially, did they get
No.
that idea?
No.
No. So it took them a little while to figure it out. And the key to doing this a lot is the history of the patient. You know, is it an intermittent phenomenon? And I always try to get the worst vision. So anyway, to make a long story short, uh, your cataract guy did a nice job. I mean, this is technically as good as any cataract surgery. But there was another ophthalmologist in the office, I guess, who might have just started to do this sort of thing with another laser, a different type of laser.
I, I'm not sure how long he's done it, but he seemed to be fairly new.
Okay.
And
And-
he didn't stay with it.
Yeah, and he did several laser sessions,
Yes.
and basically nothing happened. Correct?
Somewhat,
Maybe.
yeah, it somewhat happened, but it was still not good.
It wasn't a what I call a good outcome, which is
Right.
more or less reasonably better than where you were before. So somehow you found me. We talked on the phone. This affected your job greatly, correct? Because
Yes.
you were reviewing plans or machine work or stuff like that.
I did piecework. I can't even think what it's called now. Assembly.
Yeah, for Chrysler,
And
right?
yes,
Yeah.
and it was bright lights and shiny material that I'm looking at, trying to look at little pieces, and I just had quite a few headaches, and
Well, and your blood pressure went up so
blood
high.
pressure was sky high, and
So it affected your quality of life.
oh yes,
Yeah.
very much so.
So somehow you found me, which is great, and I've done what, 3 laser sessions more or less on each
Yes,
eye.
on each eye.
And what is your opinion now? It's
Oh.
better, right?
Yeah, it's given me back my quality of life. I feel like I can actually do something now instead of being sick all day and just moping around, and my wife putting up with my grouchiness and
Don't mope. Well, let's look forward to the future. I'm sure you will still have much improved vision. Send me a little note in a month or two after you see your optometrist up there in Peru, Indiana, and I'm sure he'll be interested in what happened. And best of luck to you. Thank
I'll
you. You're a
definitely be
great
back with
patient.
you.
I love doing this stuff.
Thank
Makes
you.
me happy too.
Thank you.